officially known as transient ischemic attacks or TIAs. Understanding these signs, especially in our beloved elderly family members, can be life-saving. Think of a TIA as a temporary blockage of blood flow to the brain. Unlike a major stroke, the blockage is brief and doesn't usually cause permanent brain damage. But here's the critical part. Up to a third of people who have a TIA will have a major, potentially disabling stroke within a year, with many occurring within just a few days. That's why recognizing a TIA isn't just important, it's an emergency. Let's dive into the 8 key warning signs you absolutely need to know. First up is one of the most classic signs, sudden numbness or weakness, often on just one side of the body. You might notice a sudden drooping on one side of the face. A simple test is to ask the person to smile. If one side doesn't move as well as the other, that's a red flag. This weakness can also affect an arm or a leg. Try asking them to raise both arms. If one arm drifts downward or they can't lift it at all, that's a serious sign. This happens because the part of the brain controlling those specific muscles isn't getting enough blood. It can be subtle, a slight tingling or a feeling of heaviness, but any sudden, one-sided weakness or numbness demands immediate medical attention. Don't just brush it off as a pinched nerve or sleeping funny. It's better to be safe than sorry. The second warning sign is difficulty with speech. This can show up in 2 ways. The first is aphasia, which is trouble understanding what others are saying or finding the right words to express yourself. The person might seem confused by simple sentences, or their own speech might come out as jumbled nonsense, even though they think they're speaking clearly. The other is dysarthria, which is slurred or slow speech. Their mouth and tongue muscles aren't working correctly because the brain's signals are disrupted. You can test this by asking them to repeat a simple phrase like, "The sky is blue." If their speech is slurred, garbled, or they can't get the words out, it's time to call for help immediately. Communication is a complex brain function, and any sudden disruption is a major warning. Third on our list is acute vision impairment. This isn't a gradual decline in eyesight, it's a sudden problem. It might be blurred or double vision, or a complete loss of sight in one or both eyes. Some people describe it as if a curtain or a shade has been pulled down over their field of vision. This happens when the blood supply to the parts of the brain that process visual information, or to the eye itself, is interrupted. It can be terrifying and disorienting. Any abrupt change in vision, even if it clears up quickly, is a sign that the brain's delicate vascular system is in trouble. Don't wait to see if it gets better on its own. This is another signal that requires an urgent medical evaluation. Sign number 4 is a severe, abrupt headache. Now, many people get headaches, but a TI headache is different. It is often described as a thunderclap headache, the worst headache of your life that comes on suddenly and with incredible intensity. It's not a slow-building tension headache. This is a sudden, explosive pain with no obvious cause. It occurs because of the sudden disruption in blood flow, which can irritate the sensitive linings of the brain and blood vessels. While not every severe headache is a TIA, a headache of this nature, especially when accompanied by any of the other symptoms we're discussing, is a clear sign that you need to get to an emergency room right away. Next, let's talk about the 5th sign, sudden dizziness or problems with balance. This isn't just feeling a little lightheaded. We're talking about a sudden, intense feeling of vertigo, where it feels like the room is spinning around you. Or it could be a sudden loss of coordination and balance, causing the person to stumble, sway, or be unable to walk in a straight line. This often points to a problem in the cerebellum, the part of the brain at the back of the head that controls our balance and coordination. If an elderly person who is normally steady on their feet suddenly starts stumbling or feeling intensely dizzy for no reason, a TIA could be the culprit. The 6th sign is something called syncope, which is the medical term for fainting or a temporary loss of consciousness. While fainting can have many causes, like low blood sugar or dehydration, when it happens in the context of a potential TI, it's due to a significant, though brief, drop in blood flow to the brain. The person may suddenly black out and then come to a few moments later, often feeling confused. If an older adult faints, especially if they also experienced any other warning signs before or after, it should never be dismissed. It warrants a full medical checkup to rule out serious underlying causes like a TI. Our 7th sign is sudden confusion and disorientation. The person might abruptly not know where they are, what day it is, or be unable to recognize familiar people. They might have a sudden inability to perform simple tasks they do every day. This isn't the gradual memory loss associated with dementia, it's a stark, sudden change in their mental state. The brain's frontal and temporal lobes, which are responsible for executive function, memory, and awareness, are highly sensitive to disruptions in blood flow. So, if your loved one suddenly seems out of it or deeply confused for no apparent reason, the brain regions responsible for processing sensory information. The person might see flashing lights, patterns, or even fully formed images. Again, this is a sudden event. It's a sign that the brain's sensory processing centers are misfiring due to a lack of oxygen. Any sudden onset of hallucinations, especially in an older adult, needs immediate investigation. So what causes these mini strokes? The primary culprits are the same risk factors for a major stroke: high blood pressure, high cholesterol, diabetes, smoking, and heart conditions like atrial fibrillation. These conditions can lead to the buildup of fatty plaques in the arteries, a process called atherosclerosis, or cause blood clots to form that can then travel to the brain. The good news is that many of these risk factors are manageable. The CDC recommends key prevention strategies. First, manage your blood pressure. Work with your doctor to keep it in a healthy range through diet, exercise, and medication if needed. Second, control your cholesterol. Eating a heart-healthy diet low in saturated fats and getting regular physical activity can make a huge difference. Third, if you have diabetes, keep your blood sugar under control. And finally, if you smoke, quitting is one of the most powerful things you can do for your vascular health. If you suspect someone is having a TIA, remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. Even if the symptoms disappear completely after a few minutes, you must treat it as an emergency. At the hospital, doctors will run tests like a CT scan or an MRI to check for evidence of a stroke and identify the cause. They might use ultrasound to examine the arteries in the neck. The goal is to figure out why the TIA happened and start treatment to prevent a major stroke. This might involve medications to prevent clots, lower blood pressure, or manage cholesterol. Recognizing these 8 silent alarms can empower you to act fast and potentially save a life or prevent a lifetime of disability. A TIA is your body's final warning shot. Please listen to it. Share this information with your family and friends, because awareness is our best defense. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe for more health content, and hit that notification bell so you never miss an update. Stay safe and be well. Have you ever heard of a mini stroke? It sounds less serious than a major stroke, but it's actually a massive warning sign that something much worse could be on the horizon. Today, we're going to talk about these silent alarms, officially known as transient ischemic